It was 1975, and in our community, we had no home health agencies. The hospitals were beginning to let their patients go sooner rather than later. And so it was time for a visiting nurse association to come to the community. There was a wonderful lady who moved here from Wisconsin. Her name was Marion Erkschner, and she became very involved in the community. And so she brought together a group of people. Some of them were nurses like myself, a few physicians, and some community activists, just to propose perhaps starting a home health agency to visit people in the home. And so we decided a VNA would be appropriate. Why a VNA? Because VNAs were organized as non-profit organizations, which means that everyone who needed home health care would receive it regardless of insurance or any ability to pay.
I think there's a need in this community for quality health care, and the Visiting Nurse Association is known for that. We had a woman who was a paraplegic, and her caregivers were so wonderful with this gal, but the one thing, she had a piece of equipment, a transfer equipment, and it was old. These people could not afford it, and they could not find the money, the funds, to buy this piece of equipment that would make her life so much easier. We funded this frame for them. I actually made a home visit and actually saw this frame in action. It really brought tears to my eyes because I felt like, wow, we have done something really, really great. We do great things every day.
One of the reasons I'm involved in the VNA is that I saw the benefit that it provided my family when my mother was a recipient of care by the Visiting Nurse Association. Also, a niece of mine needed hospice services, and she was the age of my sons. Hospice provided wonderful services for my brother, his wife, and their family. So the combination of those things made service with the VNA irresistible.
In 2013, we started honoring our veterans as they came onto the hospice program. I actually go to their place of residence, and that could be their home, nursing home, ALF, both hospitals or the hospice house. I dress in a vintage World War II nurse uniform. I present them with a pen honoring them from hospice. I present them with a certificate with their respective branch. We present them with an Afghan to keep them comfortable, red, white, and blue, which our volunteers make. And I present them with a military bear for their respective branch. And the bears sing the respective theme song for the branch. It makes me feel humble. It makes me feel honored. It is probably the best part about my job because I see the patient and the family's eyes light up. I had one veteran say to me, "You're the first person who ever said thank you." Do you cry? Yes. Do you laugh? Yes. Do you have fun? Of course.
We tried to make the best hospice house that we knew how to do with what was given. People walk in and feel like they're in their home, and that was the feeling that we wanted people to have. We even built a children's room, so if grandparents are here and they bring their children, they could play, they could be again in a friendly environment.
The hospice house is there for patients who cannot be cared for at home. They need the support of a registered nurse 24 hours a day to provide that comfort care. When I talk to patients and families about going to the hospice house, I tell them I would live there if they let me, but they won't let me.
A lot of our volunteers that we have that come to us have either had an experience with the VNA or have known someone that has had an experience with the VNA. So the majority of the people that come to us want to give back and want to give back to the community in the way that they've had services provided to them. And then we have people that just want to come volunteer with us because we have a great group of people. Hidden Treasures is a resale boutique. All of the proceeds that are raised at Hidden Treasures benefit hospice patients and go back to hospice patients in our community. The first Hidden Treasures opened in 1995 in a small store over on 14th Avenue, and after several moves and several expansions, we landed in Miracle Mile, and we've also expanded into the Sebastian area. We have about 375 volunteers that are active with the VNA.
It's very rewarding to be out in the community. It's actually a privilege to be able to help people. And when they come to us, they get to see their doctors maybe once, twice a year, and they're taking a lot of medications, and they don't realize that their medications are affecting them. And we are able to educate them on their diet, on their activities. We do help to figure out maybe any changes they can make in their life. And we had a gentleman not too long ago who came to us, and the nurse, her name's Nancy, she had taken his blood pressure for a long time. She could tell that his color wasn't good, his breathing was laborious. He said he got tired so easily. She was able to zero in on him and said, you know, I think you need to go to the emergency room. And sure enough, he did. And she knows that because he came back a month later and said, thank you for sending me to the emergency room. I ended up having a quadruple bypass, and you saved my life. Just one of those special moments that you're so grateful that you could touch somebody's life in that way. This year alone, we actually did 6,500 blood pressures and blood sugar checks in the community.
Well, this VNA has so much community involvement. It's really wonderful. The boards are very involved. The community itself is very involved. People stop you in grocery stores when they see your VNA badge and thank you so much for all the work that you've done. And it's just really very nice. It's a feeling of closeness with the community.
We have so many devoted, I think, followers of the VNA who know about the VNA. We are 40 years strong here this year. We're so lucky that we live in a community like Vero Beach that is so philanthropic, that we have people who really have the foresight and can look ahead of themselves and have the vision for what can be in this community.
People always will value quality, and as long as we continue to provide the highest quality care, we can get through any of the changes that we've seen related to reimbursement, technology, just all of the challenges, because we're going to continue to provide the same high level of care we always have.
Being associated with an organization such as the Visiting Nurse Association is very rewarding. Happy 40th birthday.
Happy birthday, VNA.
A happy 40th birthday.
Happy birthday, VNA.
Happy 40 VNA, happy birthday.
Congratulations, VNA. You're making a real difference in our community.
Happy birthday to you.